Hello. So, medication after a hair transplant plays a very important role in the success of the procedure. And while researching a hair transplant, most patients would like to know what medications they will be put on for immediately after the hair transplant and for the 6 months to 1 year or even longer after the hair transplant. I have classified the medicines that we need to take after hair transplant into three types. Number one, medicines that are used in the immediate post-operative phase to retain the hair that have been planted. These are the medicines that prevent excessive inflammation, infection, pain, swelling, itching or irritation after hair transplant, excessive numbness, and hyperacidity. Discussing them one by one, these medicines are taken only for about 5 to 7 days after procedure. Most people do not require any medication after 5th day of the hair transplant. There is no pain after hair transplant. If the procedure has been done in a minimally invasive, atraumatic procedure, there should be no pain. The painkillers that we put in the regime after a hair transplant is done is for the anti-inflammatory properties of these painkillers and not for pain always. So the drugs that I use in my practice are what we commonly call as Tylenol or paracetamol, acetaminophen. This should be used for the first 3 days because if you use ibuprofen in the early period after hair transplant, it can cause bleeding. After 3rd day of procedure, if pain persists or there is inflammation, we would like to continue what is called as Combiflam, which is a combination of ibuprofen with paracetamol or acetaminophen for additional 2 or 3 days, or perhaps a few days more. As far as infection goes, if an infection-free environment has been provided in the surgical room, is not a concern. However, to cover up, as a prophylactic measure, we give azithromycin, which is continued for 5 days after the hair transplant procedure. Swelling happens because of gravity, or if underlying vessels are ruptured and this blood with gravity seeps down into the eyes and it causes swelling. And to prevent this swelling from happening or to minimize swelling, we use corticosteroids, which are started before the procedure and continued for 3 to 5 days after the surgery. Patients after a hair transplant are taking so many medicines and the patient has undergone so much stress before the procedure, during the procedure and little after, and there is a chance that he might develop hyperacidity. We place the patient on H2 channel blockers like omeprazole in my clinic and we continue it for about 3 days after the hair transplant. If pain persists after 5 days, 7 days, it is mostly a nerve pain. And this can be quite debilitating sometimes. A patient cannot sleep at night. And this can be treated by means of pregabalin or what we call popularly known as Lyrica. 75 milligrams twice a day, increased to 150 milligrams twice a day for 3 to 5 days will take care of any pain which is due to the healing of nerves. And lastly, numbness. Numbness usually lasts for 6 to 12 weeks, but at times it might last for additional 2 to 3 months. Though it is not a concern because it is not that the scalp is totally numb. Every day is different. Every day the numbness is settling down. Every day the sensations are returning back to their original state. But it sometimes when a patient combs his head, it feels that the area is numb and he does get a little concerned about it. So after 3 months are over, we can consider putting the patient on vitamin B, a vitamin B complex, which contains vitamin B1, vitamin B6 and vitamin B12. Secondly, the medicines that are taken to sustain your planted hair or to sustain growth, to encourage regrowth. These medicines usually are DHT blockers, chief of which is finasteride or Propecia. Some clinics also like to give dutasteride, but in the immediate post-operative period, when the patient has not been exposed to either of these drugs before, so that he doesn't get alarmed and stop taking the drugs, becomes non-compliant, it is always wise to give him only finasteride, 1 milligram a day, and which is continued for 6 to 9 months after the hair transplant. With this regime, the second medicine, a topical solution of 2% minoxidil for the first 2 weeks after the crusts have fallen off, and 5% minoxidil for the next 5 months. It is known that minoxidil application a few weeks before and for about 6 months after. The second medication, as we all know, which is required to sustain hair growth of planted grafts is minoxidil, commonly called as Rogaine. Now Rogaine is started in the dosage of 2% minoxidil once the crusts are off. For 2 weeks, we maintain this 2% dosage, after which 5% is started and continued for 5 months. Since the skin after hair transplant is very sensitive, it is always better not to have a solution which contains alcohol to avoid irritation, to avoid inflammation, to avoid flakiness which will cause scratching, which can dislodge early growth. Minoxidil is important because it it decreases the telogen effluvium, the shock loss occurring immediately after the hair transplant. It also increases the hair shaft diameter. It promotes early growth and increases the number of hair which are in the anagen phase. Besides this, we give biotin. This vitamin is also continued for 6 months along with finasteride and Rogaine. Now this is all about the drugs that sustain hair growth after hair transplant. Once the patient obtains a result, if it is a minor, say grade 2 or grade 3 pattern and the donor area is lush, the rest of the hair is very good, there is no thinning in other native areas, the donor area has hardly any miniaturization, one can stop these medications. There is no problem. There is no maintenance required. But in many cases, especially in cases which are grade 3 and above, and especially grade 5, 6 and 7, the donor area has some element of miniaturization. Other areas have progressive balding, which with time will increase. Also, as age advances, the donor area becomes more and more miniaturized. Now this cannot be predicted before at the time of the surgery. So to prevent this untoward effect having a reflection on the planted hair, as you all know, is a mirror of the donor area from where the grafts have been lifted. So if the donor area starts to thin, which cannot be predicted, the planted grafts will also become thin. This cannot be predicted. So in cases which are grade 4, 5, 6 and 7, it is very important to consider long-term finasteride usage. Most people do not have any side effects. Side effects, mostly psychological, occur in only less than 1% of patients. So this is all about the post-operative medication after a hair transplant. We have divided them into 3 categories. 1 is to retain, 2 is to sustain, and 3 is to maintain the planted hair. If you have any further questions, you are most welcome to list the questions in the comment section below, and I'll be too happy to respond to you. Thank you for watching, and we'll meet in the next video. Take care.